We all have different experiences when it comes to birth control methods, and many of us experience birth control method side effects, even leading to stopping or switching those methods for alternatives. In this video, let's look at 7 birth control side effects and some tips or suggestions about how to deal with them. It's a great idea to watch this video all the way to the end, but if you want to check a specific side effect, skip ahead to one of these timestamps. Let's start with irregular bleeding. As many of you know, dealing with unexpected vaginal bleeding around the use of a birth control method is a fairly common experience. Whether it's irregular periods, a heavy flow, spotting, scanty bleeding, or bleeding at random times, anything that's outside of your usual routine can be quite a hassle, especially when it's connected to your birth control. And this is the case whether you're using the combined hormone method or progesterone only methods. So the first thing to know is that irregular bleeding often happens when you first start any of these methods. So please don't worry too much in the first instance. For many of us, this experience usually improves after the first 3 or 4 months of being on the method. If you're using the combined method, which is the combined pill or the patch or the ring, which contains more estrogen than the standard dose, unexpected bleeding is less likely. And if your combined method contains the progestogen that is newer, it might give you better control over your menstrual cycle than some of the older progestogens. But remember that what works for one woman might not work for somebody else. So it might take a little bit of trial and error to eventually find the particular method that's suitable for you. Before we think about switching methods though, please remember that there are other things that could be responsible for an irregular bleeding pattern. It may be from a sexually transmitted infection, a cervical polyp, cervical ectropion, or other changes within the genital tract. So speaking to your doctor is always wise when you experience a change in your usual menstrual bleeding or bleeding pattern, so we can check things and then reassure you if it is as a result of the birth control method, or switch it to something else if that is appropriate. Next, let's talk about headaches, something many women deal with during our monthly cycles. You know, the classic excuse that we often joke about, "Not tonight, dear, I've got a headache." Sometimes that's not an excuse, it's actually a real thing. Usually headaches during our cycle happen because of changes or fluctuations in hormone levels. Now, when it comes to birth control, headaches are another common side effect, and they can especially happen with the combined methods where you have both estrogen and a progestogen combined in the method. But before we dive into how to handle these headaches, let's understand what different types of headaches that happen while you're using a birth control method could mean. First up, let's talk about migraines. These are intense, often one-sided headaches that can really knock you out. They come with symptoms like nausea, vomiting, vision changes like blurred vision, flashing lights, and sometimes a warning sign that's known as an aura, which happens before the headache. If you experience severe headaches like this, especially with an aura, before or after starting a birth control method, it could mean a higher risk of developing a stroke. In that case, it's important to stop the method. However, not all headaches on birth control are migraines. Other types of headaches may be persistent, moderately uncomfortable, affecting the forehead or behind the eyes. And if these develop soon after you've started your birth control method, it's important to have your blood pressure checked, because sometimes having high blood pressure can sometimes be linked to persistent headaches. Another thing that's useful to do, of course, is get your eyes checked to be sure it's nothing to do with your eyes or a poor lens prescription that's contributing to the headaches. More commonly, women get these headaches during the hormone-free interval of their birth control methods. This is not the migraine type headache, and it's not related to blood pressure problems. So what should you do based on the type of headache you're experiencing while on birth control? Stop the method immediately and talk to your healthcare provider to explore other options for severe migraines or migraines with aura. If your blood pressure has gone up, it's the same advice. Stop the method and let's consider switching to an alternative. If your blood pressure is normal and the headaches aren't migraines, you you might want to look at changing how you're taking your birth control method. And this can be by adopting one of the tailored regimens where you have either the continuous or extended regimen, which eliminates or reduces the hormone-free period. Don't forget that headaches can also happen for so many different reasons, like being stressed, dehydration, and so on. So it's important to see your doctor for the right diagnosis and the correct treatment, especially if those headaches are severe and persistent. Next, let's look at acne. Here is another potential side effect of some birth control methods. Although many women don't mention acne as a side effect when using both combined methods and progesterone-only methods. And actually, many of us on the combined methods do report improvements in the acne or in our skin generally. But for a few of us, acne can pop up and be a problem after we've started a new birth control method, making us question whether it's the hormones in the method that's causing the skin changes. With the progesterone-only methods like the pill, the implant or injection, a small percentage of women may experience acne. But before switching to another method, it's important to consider other factors that could be causing the acne. So here are some things to think about. First is your diet. Eating high glycemic index foods or dairy has been known to aggravate or trigger acne in some women. So examples are white bread, potatoes, white rice, sugar-containing beverages like soda, sweet tea, sports drinks, fast foods like hamburgers or cheeseburgers, fried chicken and pizza, bagels, cakes, donuts, croissants, most packaged breakfast cereals. You know the list. You can make up the list yourself. So watch out for these things if you have developed a crop of acne while using your birth control method. Check out your diet. The next thing to think about is makeup. Certain types of makeup can contribute to acne. So if you have acne-prone skin, look for products that are labeled non-comedogenic, which means they won't cause blackheads, or non-acnegenic, which means they will not cause acne. Another potential cause are skincare changes, and this includes any changes in your skincare products or skincare routine that possibly does not agree with your skin. Addressing these factors and others is really important if you start experiencing acne. If you've gone ahead and you've looked into all these things and they're not the problem, speaking to your doctor about considering a change to an alternative birth control method should be the next step. And now let's look at mood changes. Yes, it's a big one. And this is something that some women might experience on the birth control method, whether it's a combined or progesterone only method. But first off, let us acknowledge that our mood can be affected by various factors related to our cycle. So these are things like premenstrual tension, irregular bleeding, or even menstrual cramps and pain. And interestingly, some of these issues actually improve for some women using the combined birth control method. So this is what makes it difficult when scientists are trying to look at birth control and mood changes or depression to work out whether the hormones are causing any mood problems when they actually appear to be helping to get rid of some of those conditions that lead to mood change. It's a really odd cycle, isn't it? And mood changes can also be linked to things happening in your life that has nothing to do with birth control. This could be stress at work or at home or other events. Now, when it comes to the progesterone-only method, studies have also had problems connecting mood changes like depression with methods like the pill, the implant, and so on. So, what can you do if you think that your mood definitely started changing around the time you started your birth control method? Well, first, consider checking external factors. Are there issues like a busy or stressful life or other health challenges that could be contributing to the effect on your mood? Number two, consider your diet. High sugar, we talked about diet and acne, but high sugar and high carbohydrate foods can be linked to mood fluctuations. Of course, the other thing that's helpful is to stay active. Regular exercise can boost your mood and your physical and mental health. Something else to look at is, are you taking enough breaks and practicing good self-care? Do you have days when there is less pressure, for example, taking time to socialize with your friends, treating yourself to a spa day, or doing things that are out of your usual routine to relieve some pressure from everyday life. But if you're still struggling despite trying to tweak a few things in your lifestyle, it's a good idea to talk to your healthcare provider about the possibility of changing your birth control method. If you're using a combined method and you want to stick to it, there's an option to switch to a different type of progestogen while still keeping the method combined. Another thing that they might consider is the connection between mood changes and the hormone-free period. So removing that by using a continuous or extended regimen might help avoid those fluctuations and balance your mood, especially if we've noticed that those mood changes or drops happen before your periods. So let's talk about weight gain. What can you do if you feel that your birth control method might be contributing to adding some extra pounds? Many women often point fingers at the depot progesterone shot as the main suspect for weight gain caused by birth control methods. However, let's look at the available facts here. Studies have not directly linked the shot or the injection or other birth control containing progesterone for that matter to excess weight gain. And this also goes for combined birth control methods. When they've looked into it, they've seen weight gain increases of between 0.5 kilogram to 1.5 kilograms over a 12-month period in some women, not everyone on these methods. So it's difficult, as well as other factors present, to say specifically that there is a link between the birth control method and gaining weight. However, if you've noticed weight gain while you've been on a particular birth control method, it's a good idea first to check, have there been any changes in your eating habits? Have you slacked off your regular exercise or slowed down unusual physical activity perhaps in the last few months? If you're still not satisfied, that's fine. You can consider changing your birth control method to an alternative. But at the same time, I'd still recommend keeping track of your habits to help to shed the extra weight and avoid putting any more on going forward. And now let's talk about sex drive. What is the impact of birth control on our sex drive? So your sex drive, or libido, which is just a fancy term for sexual interest or desire, is influenced by several things. For example, your culture, how you were brought up, your surroundings, how you feel mentally and physically, your age, any medications that you may be taking, and so on. Please check out this video where I talk about a lot. I think I go through more than 15 different causes of low libido in women. Does the birth control method affect your sex drive? Well, this one is also a bit of a mixed bag, because yes, some women observe a reduced interest in sex around the time or after they've started a particular birth control method. For other women, they don't see that effect. And so this could be because different factors are at play. Studies we've done haven't really told us enough that we can stand on, and we probably need a lot more studies in the area. But if your experience is a reduced sex drive since starting the method, what can you do about it? Well, start with simple things. Maybe a busy work and home schedule and the related stress is just messing things up for you mentally and just not letting you settle into a relaxed state of mind to desire or enjoy having sex. And the other thing is, sometimes we need to plan intimate times. I know it sounds funny, but when you get really busy and your partner is also busy, you might need to schedule time together away from the family and, date nights where you can relax and sort of get into yourselves. So maybe you need to plan that into the schedule and not just expect it to happen naturally. The other thing is, are there any tensions in your relationships? Because of course that can put a damper on your sex drive. If you can address these issues, your experience might get better. But if things don't improve, talking to your doctor or healthcare provider is important, because they'll consider any medical reasons or medications that you might be taking, including your birth control method. And if everything's been checked out, then changing the birth control method is an option. It's really all about finding what works best for you in the specific situation. And let us look at fertility delay. Yes, using hormonal birth control methods temporarily prevent or affect your ability to fall pregnant. That is the point of using them. But it's essential to know that none of them is able to make you permanently infertile. With that said though, certain methods the depot shots, again, are linked to a longer delay in your fertility returning after you stopped taking them. This is regardless of how long you've been using the method, whether you've used the injection for a year or longer, so it's good to be aware of this. So check out my depot shot playlist where I talk a lot about this and other issues around using the depot shot injection for birth control. Are you on the depot shot and thinking about starting a family in another 12 or 18 months? If so, consider stopping the depot shot now or within the next 6 months and switch to another method whose return to fertility is a lot quicker when you get to that point in the next year or so when you want to start your family. This will allow your fertility to bounce back more quickly when you're ready to try for a baby. On the other hand, the combined methods and the other progesterone-only methods, like the mini pill and the implant, are associated with a faster return to fertility. Experiencing a delay in fertility can be really very challenging when you're trying for a baby. Some things that can help include maintaining a healthy weight through nutritious diet, regular physical exercise, sleeping well and avoiding stress. Stop smoking. Monitor your blood pressure, your blood sugar, cholesterol levels, and take the necessary supplements like folic acid and so on. If you've been actively trying to get pregnant for at least 12 months with regular sex at least 3 times a week and it's not happening, it's a good idea to speak to your doctor. They can look at your medical details, examine yourself and your partner to work out what might be going on and help with measures to boost your fertility. So these are just a few discussions around side effects of birth control methods. And remember, we all have pretty individual experiences. Please get in touch with me via my email health information service. Here's the link and I will place that in the description box below as well for you. If you want to discuss a specific method or contact your healthcare provider. Remember to like this video and share with a friend. Check out this one next and I'll see you again soon.